Countries with advanced healthcare systems are struggling in the fight against COVID-19, and those with weaker health systems, especially in Africa, are staring at a possible greater crisis. NTV's Rose Wangoi has been speaking to two Kenyans living in Europe, particularly in Italy, the country with the most COVID-19 deaths, and the other in France, on how they are coping with the lockdown and why you, the Kenyan, needs to heed the directives.
When China announced it was shutting down Wuhan city, the epicenter of the new coronavirus outbreak, in a bid to prevent further spread, the world was turned and some experts were skeptical. Now, residents have spent most of the past 2 months at home as the government imposed unprecedented quarantine measures across the country in a drastic bid to contain COVID-19. Under the restrictions, travel in and out for any reason was banned, public transport was suspended, use of most private cars banned, and eventually house-to-house inspections were introduced, as well as the enforcement of quarantine. Spain and France have adopted similar shutdowns. In Italy, more than 60 million people are living under lockdown, with the death toll having risen to become the highest in any country, standing at over 3,400. According to government data, over 40,000 people are infected. Healthcare systems in Italy are reported to be at a breaking point, with hospitals having to turn away patients for lack of space. On Thursday, Prime Minister Conte announced Italy's lockdown would now extend past the original April 3rd deadline, with no new end mentioned. Residents are only allowed to leave their homes to buy food or medicine. Doctors and nurses are being infected due to a lack of adequate protection. NTV spoke to Frank Nyakairu, a global communication officer who is currently in Italy.
Last 2 weeks has been particularly very hard. And not being able to move out to only go to purchase food items is something that we're all trying to struggle to come to terms with. The stories coming out of so many affected areas are very awful. And we're hearing stories of loved ones not being able to say goodbye to their parents they have lived a lifetime together with. And not being able to bury them.
For now, residents are following the rules, and life has radically changed.
There's only a limited number of people allowed into the supermarket, so that's why you have to wait for so long. You have to wear gloves, but that's not mandatory, but you also have to have a mask.
France is likely to extend its 2-week lockdown to try to slow the coronavirus pandemic, as the country's interior minister blasted residents for ignoring the order to stay home. The first day of the national lockdown did not go according to plan. In some big cities, notably Paris, crowds were spotted in outdoor markets and parks across the country. On Monday, 1,200 new cases were detected in one day. France is scrambling to contain the outbreak that has killed over 700 and infected more than 10,000 people in the country. Enoch Mayo, a Kenyan entrepreneur and a trainer residing in Paris, spoke to NTV on how it feels to be in a city under lockdown.
We cannot exercise our normal freedoms, so to say, but all this is done for our health and to save lives of others. The experience is not easy, it's not normal.
According to Mayo, after people showed little sign of heeding Macron's guidance, the president implemented further restrictive measures.
One person was at a ski resort who had just come from China, and people said, okay, that is one case and it will be taken care of, it's isolated. But then this thing became more serious. As people move, so there's the virus. But when statistics starts coming out and you see loss of death, it kind of hit home.
The virus now ravaging Europe has appeared in at least 27 out of 49 countries in sub-Saharan Africa. In most of them, the recorded cases are still in single figures and have come in from abroad, notably Europe, rather than emerging at home. The stakes are high for Africa because of the state of the health systems. The Chinese government's reaction to the crisis and approach will serve as a model for how African countries, many of which are underprepared for a crisis of this magnitude, can respond. As of March 19th, 33 African countries had reported more than 600 cases and 17 deaths. More than 40 people have recovered.
Kenya and Uganda, where I come from, and other African countries need to really take these reports very seriously and act in advance.
So the only way is to take precaution.
The epidemic has birthed fear, anxiety and despair. But many are championing for utmost vigilance, adherence to government and expert rules, as well as keeping hope alive amid the storm. Rozongoi, NTV.